So we're often taught that the serratus anterior is the primary muscle involved in scapular winging, and that may very well be true, but what I find is often missed is the infraspinatus over here. So just to recap, the infraspinatus is sitting right on top of the scapula. There are usually a few trigger points in the infraspinatus. The main one that you're going to find is if you find the inferior angle, the spine, go about halfway down, just a little past there's usually a little ropey spot right in there. So what I find is if we treat this ropey area and any other trigger points in the infraspinatus, it will release this tension from the scapula to the humerus, create more mobility in the glenohumeral joint, and allow dissociation from the scapula to the humerus, and actually reduce some scapular winging. So what happens is, if the scapula and the humerus are kind of locked together and moving as a unit rather than dissociating, and they're locked because the infraspinatus is hypertonic and it's stiff and it's not elongating, then when the patient goes to lift their arm, rather than dissociating cleanly through here, the whole scapula will move with it and move as a unit. And that's going to create too much scapular movement. It's going to put some of these muscles on elongation and stretch, and the pull from the infraspinatus, pulling from the humerus to the scapula, it's going to actually pull the scapula forward, especially when the anchor point on the front, like the pec minor, is already tight. So it's just going to contribute to that winging sort of position. So if we can release the infraspinatus along with the typical culprits like the pec minor, then go in and strengthen serratus and lower traps, you're going to get better results treating shoulder pain, improving scapular dyskinesias, helping with neck. A lot of neck issues will resolve with this as well, and then also helping with some thoracic components too. So with any treatment, we always want to be thinking about why is this dysfunction here in the first place. We'll cover that in another video, but for now we're just going to focus on how to treat the trigger points in the infraspinatus, get your patient some relief. They're going to feel the change in the session, and you're going to help with the scapular dyskinesias and the scapular winging. One of my preferred techniques is dry needling. So you're going to find the scapula, going to go about halfway down and a little more. There should be a little ropey band. You can kind of see it flicking over right there. You're going to locate that band, put the needle there, and then and then insert the needle in and out. It's easy to get through and all the way down to the scapula here. Now, you may choose a few different spots. It's usually a bit tender. That releases nicely, but there's going to be another spot right next to it, so let's get that one too. I find there's usually about 3 or 4 areas in the infraspinatus. This is going to depend on which sports the patient plays. Like if they're playing hockey, there's a little twitching in there. If they're a hockey player and they're left-handed, they're usually going to have more infraspinatus tension on the left because they're held in external rotation more often. And the right shoulder would have more trigger points in the subscap and the internal rotators there. The twitches are totally normal. It means you've hit a very active trigger point, likely a point that's holding on to a bit more sodium, potassium, calcium, and when you needle that area, it's releasing those components back into the bloodstream to flush out, and that's what creates that twitch response. And I always like to make sure the patient knows that it could be a bit tender after, but it's totally normal. They can apply some heat and do some gentle stretching to help with that. Another one of my preferred treatment approaches is the dolphin neurostim. We don't use a lot of modalities typically, but acupuncture and the dolphin are quite helpful. So what we're going to do here is we've found an area where there's some trigger points. We're going to take one unit on negative and apply it to that point. There are acupuncture points in the shoulder in this area, like small intestine 10 and 11. So we can stimulate those. Another option is you keep one unit there on negative. Another is going to go on biphasic. So if a patient has not only tension here, but palpable tension right under the shoulder blade, like right where the scapula is meeting the ribs and it's hard to get in there compared to the other side, then I highly recommend this approach that I'll demonstrate now. It can really free up all of this parascapular region, which is going to help a lot with thoracic spine issues, especially if somebody's going to the gym, doing rows, using weights, and then they're coming out with thoracic spine problems. This is a very effective treatment. So you're gonna put one unit negative on the trigger point, the other unit on the biphasic. I'll just turn the sound off for now. And what you do is you take the biphasic unit, and it's gonna be paired with the negative unit, and you move around the scapula, going a little faster just for the sake of the demonstration. We go around the scapula, that's gonna pass a current from one unit to the other, free up any adhesions, which can definitely be developed under the scapula, common in things like snapping scapula syndrome, common in athletes who have a lot of demands on the shoulders, baseball players, but really anybody, especially if there's previous injuries, maybe a shoulder dislocation, rotator cuff tear, anything that's going to compromise the motor control and the variability in movement that's available in the shoulder. Anything that will do that can contribute to adhesions, scar tissue, and things that this will really help to break down. So from here, I would go all around the shoulder blade, spending about 30 seconds on each point. And this will really free up the scapula and help with the reducing scapular dyskinesias, but also helping with thoracic spine, neck, and shoulder problems. So the third technique is just a classic kind of pin and stretch tissue technique. I don't use this one a lot. I find I get a lot of results with the acupuncture, the dolphin stim, and then treating the peripheral nerves, like the C5 nerve root that's going to innervate this area, C5, C6. But this one, if we are going to use a pin and stretch and we really want to target that trigger point, what we can do is have the patient in a bit of abduction. We can find that trigger point, kind of pin down, and then move it into its elongated position. So start with it in a shortened position, and we're going to move into some horizontal adduction and internal rotation to really start to stretch it. So we start external, pin, move into adduction and internal rotation, and repeat that wherever you're finding the trigger points in the infraspinatus. You do want to be careful if the patient has any rotator cuff issues, that you're careful with the internal rotation component of this. You don't want to create any impingement. Always looking for feedback from the patient, judging by their facial expression and checking in with them. So it's always good, obviously, to give the patient some homework so they can continue to work on this between appointments. So this is one that I prefer. We're going to take a trigger point release ball. We're going to place it on the infraspinatus, and then you have the patient lean into the wall. And when they're doing this at home, they can experiment with the spot, try to find a bit of a hot spot where it's tender. They're going to find that spot, bring their arm into abduction, and then just like the trigger point release, they're going to move into external rotation, internal rotation. They kind of move through there. They're shortening and lengthening the muscle while there's pressure on it. They're gonna, if they can, they're gonna move into a bit of horizontal adduction, maybe add just a little bit of internal rotation, external rotation, and come back. And just move through these movements. Again, paying attention, they don't want to reproduce any pinching or pain in the shoulder if there's any impingement or rotator cuff issues there. I would do this for a minute or two at home in preparation for some other strengthening exercises that will follow.